So does your bladder leak when you laugh, cough, sneeze, run, or exercise? And maybe you've tried doing Kegels, you might have even seen a women's health physical therapist, or you've talked to your doctor about what's going on, and yet your bladder's still leaking. Well, I'm going to share with you exactly what's going on and what you can do about it to help your bladder to stop leaking. Hi, my name is Lynn Schulte. I'm a women's health physical therapist. I own my own practice in Boulder, Colorado called Intuitive Hands Physical Therapy. And I am your postpartum recovery expert. For the last 8 years, I've mainly been working with pregnant and postpartum women, and I've learned a ton about the postpartum body, and I'd love to share that information with you so that you can help better manage your body after having a baby. And so today we're going to be talking about bladder leakage after childbirth. And this is a pretty common issue that some women have after having a baby, that whenever they go to laugh, cough, sneeze, jog, their bladder might start to leak. And what, you go to your doctor and your doctor's like, well, everything looks okay there. Just give it a few more months. It might go away eventually. And sometimes it does. So yay if it does. But a lot of times it might not. And what I'm finding is that the bladder really gets tweaked with the way the baby's head comes through the pelvis. So if we have our pelvis here, okay, this is our front view of the pelvis. This is looking down and in. And if this is your bladder here, the bladder actually sits right behind this pubic bone here, okay? And so this is where the bladder is sitting. And what happens as the baby's head comes through the pelvis is it actually gets shifted and squished off to the left-hand side. So when I'm doing my internal work with women, what I find is that there's less space over on the left-hand side as compared to the right-hand side. So just to give you another view of this, so this is a cross-sectional view of you, where this is your pubic bone, you have your bladder, your uterus, and your bowel. And so the bladder, you see the green is the bladder, and then this red is the bladder, is the urethra, and the where the urine comes out. Well, in our body, we actually have a sphincter, a valve that keeps the urine in right where the red and green meet. That's an internal valve, and then we have one down here at the opening called the external sphincter. Now, what happens with the way the baby comes out, oops, put the wrong one down. If you can think about this bladder here and how it's sitting right in the middle, imagine it's squished off to the left-hand side, okay? So instead of being straight up and down, okay, my finger is going to replace the bladder here. Now, all of a sudden, it gets squished off to the side. And can you see what's going to happen to this internal sphincter right here? Okay, it gets compromised. So again, if my fist is the bladder and this is the urethra, and here, right here is where the internal sphincter is, as the babies come through, the bladder gets smushed off, and then it kinks this internal sphincter. And so the sphincter then can't close fully. So it might be okay while you're walking around and just moving normally, but if you go to add increased pressure like laughing, coughing, sneezing, you can find that you leak a lot. So when I do internal work with women, I'll assess their urethra. I just use a glove finger. I don't use a speculum or anything. And I will run my finger along the left-hand side of that urethra. So if, again, the bladder here is, this is the bladder and then this is the urethra. Let's see, it's easier to do with this finger because it gets kinked over here. So then when I bring my finger in along the inside here, it'll be shorter on this side and it'll be longer on this side. So that way I know that there's some kink going on there. Also, when I check the bladder compared to the outside vaginal wall, there's less space over here and there's more space over here. Again, that's telling me that the bladder got pulled off to that left-hand side. And so really no amount of Kegels is going to change this bladder position. And if you've waited 6 months, a year, and you're still leaking, your bladder's just not in a happy place in your pelvis. And so you need to get some internal work, internal visceral work done to help get the bladder back to its normal position and straightened out and get this sphincter released so that it can open and close fully again. Now, the longer the bladder has been held in this kinked position, the more energy, the more work it's going to need to just kind of remember what normal was again. So the sooner you can come in and get help, the easier it is to release this and help the bladder to remember what normal was or is again. So, it doesn't help to wait years and years to get some help. If you can do it sooner, it's just easier. The longer you wait, the more effort and energy it needs for the bladder to remember what normal was again. So know that there is help. You just need to find someone who can do internal work with releasing your bladder and helping your bladder come back to its normal position. Now, the other key piece to understand about the bladder is that what I'm finding, it's kind of the kingpin for the entire pelvic floor area, and that when we've got increased tension and tone in our pelvic floor muscles, when I release the bladder and get the bladder back to its midline, and I call it happy state, it relaxes the pelvic floor muscles. So if you've got increased tension in your pelvic floor muscles and they're not relaxing, it could be because your bladder's in a state of tension as well. And for some reason, the bladder rules the other tissues in this area. And when you get the bladder back to its normal position and relaxed in there, the pelvic floor muscles automatically relax without even having to work with them. It still helps to do a little bit of soft tissue release with them, but getting the bladder back into its normal position is super, super helpful for getting greater function and activation of those pelvic floor muscles and getting them to release as well. So there's your anatomy and information about why your bladder is still leaking after having a baby. And I hope that you find that helpful. And again, haven't figured out how to help you be able to do that for yourself, because a lot of times the bladder can be it can be traumatized from the birth, and there's different qualities to the bladder tissue that I find in women. Sometimes it'll feel kind of swollen or puffy, and once we release it, it just gets back to its normal kind of normal tissue feeling in there. So I wish you could do that yourself, but I really encourage you to find someone who can do internal work with your pelvic organs and your bladder specifically to help it find its normal midline position so that it can stop leaking for you. All right, I hope that helps everybody. Take care. Bye-bye.